Hello everyone, welcome to Sharmit. In this session, we are going to talk about another very important topic of medical coding anatomy, where we will be mainly discussing about the superficial external anatomical term of direction. I'm sure you have already watched the previously released session where we have covered other anatomical term of direction like anterior, posterior, superior, inferior, right? So this session is in the continuation of the same, where we are going to talk particularly about the superficial external anatomical term of direction. Okay. But before we proceed further with this session, I would like to recommend you to please go and check out the previously released session first if you have not watched, because they all are in proper sequence and sync. So if you follow it sequentially, then it would be much more easier for you to understand the ongoing topic. Because for time being, we are just mainly focusing on what is superficial external anatomical term of direction. But prior to that, you should know about other terms that we have already covered. And for that, you can also refer the Sharmit digital course book, which is freely available in the description box. There you will find thousands of sessions, a particular tab for medical coding, where all the sessions are available in both Hindi as well as English language. So without any language barrier, easily you can consume the content, and in case if there are any question, you can simply reach out to me through comment section so that I can help you there. Okay. Alright, so let's get started with superficial external anatomical term of direction. We will start from the definition itself. So in an interview, if someone asks you what is superficial or what is external, so you can simply say superficial means closer to the surface of the body and toward the outer surface. Okay, so it means closer to the surface of the body toward the outer surface. In simple word, you can say any structure or a body part that is nearer to the skin or outer surface of the body is called superficial. Okay, near to the skin or outer surface of the body is called superficial. Okay, so in simple word, we can conclude it three words like superficial is closer to the surface, toward the outer layer, or near to the skin. Now here we have one synonym for external for superficial, that is external. Okay, so superficial is also called as external. Both words are related in the meaning toward the outside or surface. Now there might be one question, like in that case, if they both hold the same meaning, then in which scenario we will use these types, right? So superficial is mainly means closer to the body surface and skin, generally used in general anatomy and clinical medicine. Okay, so if we are using general anatomy or clinical medicine terminology, then we will go with the superficial term. Okay, same thing, we have external, which also means toward the outside or outer surface, but it is mainly used for hollow organs, body cavities, and a specified anatomical structure. Okay, so that's the main difference between both of the terms, that both are representing the same closer to the body surface or skin, but are used in different context. Clear? So we can say that superficial is used when comparing the depth of structure, how close something is to the skin surface. External is more commonly used when describing the outside of a hollow organ and body cavity. Okay, so the example is the external surface of the stomach means the outside wall of the stomach. The external ear means the outer visible part of the ear. Okay, so in general anatomy, you can say both terms are used and are closely related in the meaning. However, they are not always preferably interchangeable. This is very important line. Okay, it means it is not interchangeable, but other than that, whatever we have learned so far, whatever terminology we have covered so far, they are interchangeable in nature. So superficial refers more to the depth of the skin, while external refers more to the outside structure of the cavity. Okay, so this thing you need to keep in mind, otherwise this might get confuse you at the time of answering the question in interviews or exam. Clear? So this is the thing. Now let's see what is the opposite term. So the direct opposite term of superficial is deep or internal. Okay, so superficial means closer to the surface or skin. Deep means farther from the surface toward the inside of the body. So these two always work as a pair. You cannot understand the one without knowing the other one. Okay. Example are very simple. The skin is superficial to the muscles. The bone are the deep to the muscles. Okay, so these two can easily explain what is the meaning of superficial and what is the meaning of deep. Now here you can see there are multiple examples I have noted down. Some of the examples are in a plain sentence, medical related, and some sentences are in terms of medical coding itself. Okay, so let's go one by one. The first sentence say the skin is superficial to the muscle. That means the skin is closer to the surface than the muscle. The muscle are superficial to the bones. The muscles are closer to the surface than the bones. The epidermis is superficial to the dermis. The outer skin layer is closer to the surface than the inner skin layer. The cephalic vein is superficial to the bicep muscle. The cephalic vein is closer to the surface than the bicep muscle. So I think by looking at the example and its meaning, it's quite clear what is superficial, right? Now let's see how it is used in medical coding, ICD, MCM and CPT. The word superficial, because it is the word that is frequently used, right? So let's see the first thing, that is superficial wound, which means a wound that only affects the skin and subcutaneous tissue, does not go deep into the muscle or bone. Then next is superficial burn, a burn affecting only the outermost skin layer, epidermis, also called as the first degree burn. Okay, so in the first degree burn we are using this term superficial burn, a burn affecting only the outermost layer, epidermis. Superficial partial thickness burn, a burn affecting epidermis and superficial dermis, also called as second degree burn. Okay, so this is second degree burn, this is first degree burn. Then we have superficial thrombophlebitis, inflammation and clotting of superficial vein commonly affects the varicose vein. Okay, so this is also an example for understanding the superficial. Right, so I think till now everything is clear, like how it is used in medical terminology and normal medical sentences. Now let's try to see what are the all combined directional terms that comes with superficial. The first term is superficial and lateral, which is close to the skin surface and toward the side. Second is superficial and medial, close to the skin surface and toward the midline. Third is superficial and anterior, close to the skin surface on the front of the body. Next is superficial and posterior, close to the skin surface on the back of the body. So these are some good example for combined term. Now we have few clinical examples related to superficial. So a superficial lateral burn means a burn on the outer surface of the side of body. A superficial anterior wound means a wound on the front surface of the body that has not gone deep into the tissues. Next is a superficial medial thigh. Abscess means a collection of pus near the skin surface of on the inner thigh. Okay, so these are some good examples related to the clinical terms of superficial. Now we have learned so many things related to superficial. So how we will remember it, because other terms are also there, right? So there are some tricks that you can refer. So here you can see in superficial the first letter S stands for surface. Surface means close to the skin. So superficial is on or near the surface, like a surface of water. Deep means below the surface, like the bottom of the ocean. Okay, so we can say superficial, what you can almost see or touch through the skin, but deep is what is inside, what is hidden far inside the body. So it's quite simple that the outermost layer of the onion most superficial, the innermost layer are deep. Each layer going inward gets progressively deeper. Okay, so there are two types of cut. A superficial cut only scratches the surface, it does not go deep, but a deep cut goes below the skin surface into the muscle or a deeper. Clear? So this trick can help you to answer the questions in interviews. Now for today there is one question for all of you, and the question is quite simple. What is distal anatomical term of direction? I am sure you know the answer of this question already. So please do share your knowledge in the comment section so that others can take a reference from it. In case if you have any doubt on this question, then you can simply reach out to you can simply watch the last session which is already published. There I have explained everything in detail. So from there you can take a reference. But do share your knowledge, because once you start writing the answers of this question in the comment, it will instruct me that you are learning from this session, and accordingly I will release the other sessions that I have already prepared for the medical coding playlist. Clear? So yeah, that's all for today. See you in the next session with new topics. So thank you for watching Tech Sharmit.